Good afternoon, everyone. My name is Morgan Reinage from the New England QIN-QIO, and I'll be moderating today's webinar. Thank you for joining us for this webinar in the series for the New England Home Health Collaborative. Today's session is Ban the Bug. Before we get started, I'm going to review a few housekeeping items. This webinar is being recorded and will be on our website within a few days. I'll provide you with additional details on accessing that at the end of the webinar. Phone lines are on mute for the duration of the presentation, but we will be taking questions at the end, and I'll provide you with instructions on how to unmute your line at that time. For now, I would like to introduce today's speaker, Roby. Kathy is the Connecticut Home Health Lead for the New England Quality Innovation Network Quality Improvement Organization. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider-clinician outcomes, and reducing acute care hospitalizations for Connecticut home care providers. Please welcome Kathy Roby.
Good afternoon, everyone. Well, I would have said, isn't it nice to have a wonderful sunny afternoon, except that I just looked out the window and discovered that the sun is gone here. I have no idea what happened to it, but it's definitely gone. So here we are, it's October, and we know that the flu season has arrived. Every newspaper you pick up has flu clinics listed. People are asking where they can get their flu shots. They're lining up in the Walmart, in the Rite Aid, in the Target store, and in the community-based clinics. And hopefully, you're getting calls in your agencies asking about immunizations for flu and pneumonia. Today's presentation is called Ban the Bug. Immunizations are not just for kids. It's very important, it's critical that we get the word out there that absolutely everyone who is eligible should be immunized for influenza annually and pneumonia, because that is the best way for us to improve the general health of the population and improve the outcomes of the people that we care for. As Morgan said to you, I'm coming to you today representing the New England Quality Innovation Network. We are a group, 2 companies focused on the improving the quality of care, who are working with providers across all 6 states. And you can see there where each of us has listed our focus areas. We have a website, appropriately called healthcarefornewengland.org. And I'm going to show you just a couple of slides of how you can find really terrific information that you'll find very helpful as you go through your daily visits and working with your customers, your clients, your patients. When you land on the home page, right there, almost in mid-center, you're going to find a tab that says For Providers. If you click on that, the drop-down shows that home health is second in the ranking there. Click on that, and it's going to take you to our page. On this page, we have 3 focused areas, and behind each of those links is information on the different things that you can do. There are tools, tips, best practices, and listings of educational events, all of which are designed to help you to provide better care on a regular basis. Also on this section of the website, you will be able to find the links for some of the webinars that we have done in the past. This list will give you the direct email for your state's contact person. Massachusetts has chosen to do theirs as a group. That's why you see 4 names there. We do have teams of consulting people for this project in each state, and the lead person is listed under every state. Today, we are very excited to welcome a new agency. In the state of Maine, Doreen has invited St. Joseph's Home Care to join us. Welcome to St. Joseph's. I hope you're on the line today, and I hope that we are able to work closely with you in the coming months. So what do we want to talk about? Our flu shot's just kind of a, oh, ho-hum, it's October, and I guess we'll give a few. Or, we don't do that here. Call your doctor and make an appointment. We're all about improving the health of our population and the outcomes of those patients that we are serving directly. Immunizations can directly improve those outcomes for the general population and for your caseload. Who knew? Sorry about the bad pun. I just couldn't resist. By the time we're done today, hopefully you will have a good understanding of the link between immunization and improving cardiovascular health and outcomes for your patients and for your service area population. You will be able to identify what the rationale is for administering both of these vaccines to all eligible persons. You will be able to take a new and different approach to motivating all eligible patients to receive those vaccines by initiating the conversation with motivational interviewing techniques and SMART goals. And lastly, we are going to talk a little bit about understanding the impact and the importance of immunizing your staff members. Last week, when I was preparing today's presentation, I picked up the Hartford Courant, that's our local newspaper here in Connecticut in the city of Hartford, and discovered that an article on the front page had actually made it above the fold. And the topic was immunizations and flu shots. They discussed the Healthy People 2020 initiative regarding influenza and Pneumovax immunizations. They identified that the target for immunization for all eligible persons of all ages is 70% of the population. Pneumovax immunization for eligible persons was 90% of the eligible population. And for healthcare personnel, they would like to see us achieve 90%. We have some polling questions in here. And so we're going to stop for a second and have you answer a quick question. And while you're doing that, I hope that you may have at some point run your CASPER report and taken a look at what your OASIS data says about your patient population. What is your current ranking? What percentage of your eligible patients have actually received influenza and Pneumovax immunizations? Are you close? Have you reached or exceeded the 70 and 90% target? What about your own staff? How close to 90% are you? So our first question today is, according to the CDC, the Center for Disease Control and Prevention, which of these four populations has the highest hospitalizations due to influenza? Do you think it's pregnant women and small children? What about those folks with underlying chronic illnesses such as CHS, COPD, diabetes? What about toddlers, children under the age of 5? What about the other end of the spectrum, 85 and older? Select one of those, and we will look at the answers at the end. Our second question is, who do you think should receive the pneumococcal vaccine? Look at the four choices. Do you think that everyone should receive the vaccine? What about those who are currently over 65? What about the folks that smoke or have asthma? What about folks with an underlying disease process such as diabetes, CHF, or COPD? You will need to select one of those answers in order for your answer to be recorded. You will need to click the submit button at the bottom. I'll give you a moment, and if you like, we can go back to the previous question. Make sure that you've selected an answer and then hit the submit button. What do you think the link is between immunizations and improving our outcomes? For our patients, for those persons that we see in the home. If they contract influenza, if they develop pneumonia, and they already have an existing diagnosis of CHF, COPD, or diabetes, this is going to exacerbate these underlying chronic conditions. You're diabetic. Very often the first symptom is not the nausea, the vomiting, the diarrhea, and the fever. The first symptom may well be erratic, extremely high, extremely low blood sugars that don't respond. What about your CHF patient? That underlying fluid retention, fluid imbalance problem is going to suddenly be so far out of control. And that symptom of edema, shortness of breath, will often appear well before the typical symptoms of flu. The COPD patient and the CHF patient very often will go directly from a case of influenza, no matter how mild, into pneumonia, because they have limited endurance, limited resistance, they have difficulty with clearing their lungs, they don't take full deep breaths, and they can become very short of breath very easily. What does this do to us? What does it do to their outcomes and yours? It's going to cause emergent care and or directory admissions. Those are negative outcomes, both for you and your patients. If your patients and your staff smoke or they have respiratory problems, asthma, bronchitis, acute allergies, they are at very high risk for complications. You truly need to teach not just quitting smoking, but standard precautions, good hand washing, staying home if you're sick, because you don't want this to be spread around. In terms of your staffing, every time a home health aide, a nurse, a therapist, a clerical person, a supervisor, every time someone calls out sick because of the flu, because they didn't have a flu shot, your costs are going up. Billing's delayed, visits don't get made, and a patient has an exacerbation. There are a myriad of different things that can come from this, and every one of them will have a negative impact on your ultimate outcomes. So, you go out, you talk to your new admission, you ask them if they've had a flu shot, and the first thing they say to you is, I wouldn't do that. Flu shots just give you the flu. I know, because I had one 20 years ago, and I was sick as a dog for a week. How many times have we heard that one? I was going to put up on the screen the 10 most common myths about flu shots from the American Lung Association, but we've all heard them. And we really need to focus on how are we going to educate our patients and the community that these really are myths. They're really not true. We need to convince them. Flu shots do not give you the flu. There are not millions of live little viruses in there just waiting to leap into your lungs and make you sick. How are we going to accurately screen our patients so that we are immunizing those people who should be immunized? How are we going to motivate them? How are we going to get past, my neighbor had the flu shot at the clinic and she got sick? And do you provide immunizations in your patients' homes? Or do you only refer to physicians' offices to do that or to the community-based clinic? It is very possible to provide immunizations in the home, remain within the regulations, state and federal, and actually be reimbursed. And please, let's be real, no one ever gets reimbursed cost plus, but at least you can cover the majority, if not all of your costs when you go about this process. So we will talk a little bit about that. Prescreening is an important component. We need to be obtaining an immunization history. If the patient is being newly admitted in the months of October, November, December, and January, clearly, even right through the February and early March, this is all the flu time period. You want to be sure that you are getting a history from them. Have you ever had a flu shot? Did you have one last year? Did you have one this year? If the referral came from any type of inpatient facility, do you know if you had a flu shot inpatient while you were in the hospital, in the emergency room, in the rehab facility, in the skilled nursing facility? We need to at least ask the question. The fact that it's not on the referral paperwork does not mean they didn't receive it. You need to ask the question, and you may need to circle back and call the referral source and have them check the records to determine whether or not this person has had the immunizations and whether or not they've ever had a reaction. When you are in the process of the screening, you will be able to ask all the appropriate questions to determine whether or not they're an appropriate candidate for influenza and pneumonia immunization. Because this presentation is a follow-up to the presentation that was done by CHCE on this topic, we have not included in the slides themselves the screening tool. In the best practice intervention package, there is an excellent step-by-step algorithm that will walk you through exactly what questions you need to ask, what answers you need to get, and how to make the determination as to whether or not this individual is a good candidate to receive the flu shot or a pneumovax immunization. Once you've made the decision that definitely this is a person who is appropriate and should receive the shots, we need to move then to talking to them about it. Simply saying, I have flu vaccine in my bag, or I can bring it out next time, would you like a flu shot, very likely will draw for you the response, flu shots give you the flu. No, I don't want it. When we know how very critically important it is that this congestive failure patient have a flu shot. We're going to talk a little bit about motivational interviewing and the methods of how we can frame the conversation in such a way that you're educating your patient, convincing, persuading, encouraging, so that they will be interested and willing to have both a flu shot and a pneumovax if they've not had that one before. Once you've done some education and the individual has agreed that yes, if it's appropriate and their doctor says so, they would be willing to do it, you need to contact the physician. If you can, review the decision tree algorithm with them. Obtain the order, and then if you are doing flu shots directly, you will be able to then proceed to getting the flu shot in the home. If you don't do this in your agency, then you want to be scheduling an appointment, assisting the patient to arrange transportation, and making it possible for them to get that immunization as early as possible. Let's talk about that discussion. Hopefully, from previous programs we've done, you are familiar with the OARS method of having a conversation. OARS is a way of talking with people that encourages them to actually have a conversation. We use open-ended questions. Avoid those questions that lead to a simple yes or no answer. That closes the door. We want to open it. One way to open it, if you see pictures of small people, is to ask about their grandchildren. Will they be coming to visit you? Did you notice whether or not they seem to have a lot of colds or little viruses after they started school again in the fall? You know, we tell our kids to wash their hands all the time, but son of a gun, they pick up everything, don't they? So how do you think you might protect yourself from picking up a virus from your granddaughter, from that, or giving one to that new baby? There are lots of different ways that you can find the key that will open the door to the conversation. By raising the topic of flu, asking about their friends. Has anyone been ill so far this winter? What about you? Have you had any bad colds? What's your goal for this winter season? How do you think you could protect yourself from the flu? One way or another, in the course of the conversation, what you're trying to elicit from the patient is, that his or her goal is to stay at home and be as well as possible. This gives you the ability to open the door wider and offer the flu and pneumonia vaccines as the key to staying home. You're offering them this as part of their plan to stay home. Remember, the other half of the conversation is always debunking those myths. Flu shots don't give you the flu. Hand washing will help you, but immunizations are best. There are several excellent patient education tools on the HHQI website. You want to be looking for handout materials that are both literacy level and language appropriate. You can get them translated. You can have them proofed for a literacy level somewhere between the 4th and 5th grade to be able to be understood by the largest majority of people. Let's talk a little bit now about why it would be a good idea for your agency to offer immunizations directly to your patients. First of all, we all know how hard it is to get our patients out to the physician's office. Sometimes it feels like it's an act of Congress. I need to organize a ride, got to find a family member to go with them, can't bill for the aide to travel with them, so I'll have to find somebody else. Dial the ride can't take them that day. It's 18 different phone calls trying to get the ride, the person accompanying them, and the date and time of the appointment all to line up. So it is easier if you are able to do immunizations directly in your agency. It gives you more control over that correlation between increasing the immunizations you offer and decreasing the emergent care and the readmission hospitalizations. It gives you more control over improving the outcomes for all of your patients with chronic illnesses such as CHF, COPD, and diabetes. What would you need in order to initiate and manage an in-home, homebound, community-based flu program? There are some sample tools on the HHQI website in the best practice package for immunization. Having done this, set up and managed a long-term immunization program in an agency that gave about 1,800 flu shots a year, I can tell you that what you need are only a very small number of policies, something specific that requires the screening tool be done, that the consent forms be signed and witnessed. You need a reaction protocol, an anaphylaxis order. You need a standing order form. When I say a standing order, you're going to need an adrenaline or epi order. That can be a standing order that is issued and approved by the physician on your professional advisory committee. You can then create a format for a telephone order, a verbal order, for the individual patient-level orders for the immunizations themselves, so that you would then have this master form. You would enter the patient's name, address, date of birth, and the date that you plan to give the immunization. Check off that it's a flu shot, check off that it's a Pneumovax, indicate the dose, put the lot number on there if you have it at the time you're getting the order, and then send it over the fax. Once it comes back, signed by the physician, you're good to go. You now have standing orders from your PAC for an epi order for an emergency. You have patient-specific orders to give the immunization, and you can easily obtain all the forms that you need online for information about the vaccine and the actual consent forms. Billing procedures are in the Medicare billing manual, and there are two different ways you can go about that. It's really not a topic that we are intending to discuss on this type of a program, but there is extensive, very clear information on roster billing and patient-by-patient billing so that you can recover some of your expenses. If you are orderly and organized, your expenses will be very limited. Let's talk about your staff a bit. Earlier on, I said that we would talk about the impact of having your staff immunized. Are you going to offer influenza immunizations to all of your staff, in-house as well as visit staff? Will you offer those immunizations only to direct service or patient care staff? Have you made a business decision not to offer any immunizations to your staff for flu or pneumonia? Select your answer and press the submit key, and we'll come back and look at the percentages later. Of the different healthcare professionals, remembering that early on we said Healthy People 2020 is seeking to immunize 90% of all healthcare providers. Which of the following groups do you think has the lowest flu vaccination coverage rate? Aides, nursing assistants? What about the pharmacists that are standing there at the CVS, the Rite Aid, the Target, and the Walmart giving out the flu shot? Wonder if they had theirs. What about physicians? What about your nursing staff? What about you? But what about them? Which one of these four groups do you think has the lowest rate of flu vaccination? Select your answer and press the submit key. Now that you've had a moment to select your answer, go with your gut. It's okay. Nobody's grading us today. I want to confront the cost issue. Yes, immunizing your staff can be expensive. If you have a large staff, it could be costly. But let me tell you, my experience has been that sick time, lost productivity, even if you don't pay sick benefit time to your per visit per diem people, lost productivity. These are far more expensive than the cost of the vaccine and the time involved in managing an in-house staff flu clinic. And if you're not doing it, it's entirely possible that your employees could be making your patients sicker. We are not going to be including standard precautions and hand washing in today's presentation, but we do all know the role that this plays in how your patients may be picking up influenza and even pneumonia. So let's bear that in mind as we think about whether or not you want to have a clinic in your office. Standard precautions, even if you're teaching it to everyone, including your patients, doing 100% competency on all of your staff, flu is highly contagious. Standard precautions may still not be enough to protect you or your patients. The illness can be passed on to many people long before the symptoms appear. The impact of one person's absence can affect all parts of the agency, and it clearly will increase your costs and decrease your patient satisfaction. For example, let us say you do not provide benefit time for your home health aide, nursing assistant population, only for your full-time staff. So the family, the children of one of your receptionists, billing people, and administrative assistants, all the kids had the flu. But that particular employee, because he or she is highly dedicated, has decided that they're going to come to work even though they really just don't feel very well. So they come to work for 3 days feeling not very well, and then they're down flat in the bed. They're out for a week because they came to work sick for 3 days, and that meant that their illness lasted longer. So now, in the 3 days that they were in your office, they've passed on that influenza bug to 10% of your staff, including visit staff. And perhaps one of those visit staff was the one nurse who didn't make it to standard precautions training that day. So she might not be washing her hands quite as long or using the Purell every time she should. And as a result, 2 or 3 of her patients next week have influenza. And one of them is now in the emergency room. It's a trail of dominoes. The first one goes down, and the others are clicking away, falling over right behind it. This is going to increase your cost. You're losing productivity from the employee who's now out flat for a week. Your patients are unhappy because the aide who caught the flu stayed out sick, and they love that aide and won't pick anyone else, so they haven't showered in a week. There are so many ramifications and such a simple solution. And least of all, how can you expect your patients to get immunized if you don't believe it enough to offer it to your staff and get immunized yourself? Let's go back. Let's take a quick look at those questions we asked. Who has the highest rate of hospitalizations? The answer was 85 and older. This is a fragile population with multiple comorbidities. The majority of them that we see have congestive failure, COPD, many are diabetic, leaving them open to high-volume complications and comorbidities. Who should receive a Pneumovax? Anyone who's over 65, anyone who smokes or has asthma, and anyone who has a chronic illness. Because a compromised respiratory status is an open door for comorbidities and readmissions. Guess who has the lowest rate of immunization? It is your home health aide. If you're not offering the immunization in your agency itself, very often it is your paraprofessional staff who have difficulty locating a free clinic, difficulty fitting the copay into their budget, and may or may not clearly understand why this is so critically important for them. So yes, you need to educate your staff. Yes, you clearly need to try to get them, if you're not going to offer it in-house, provide them with a list of where they can go at no cost or low cost. Perhaps you even subsidize the low cost, reimburse them the copay. Whatever it takes to get your staff immunized, that's the critical issue. Part of our project in improving cardiovascular outcomes is to look at the Million Hearts Initiative and how we can work with them to improve heart health and to reduce the risk of cardiovascular disease. How can your agency support cardiovascular risk reduction and promote winter wellness? A time of the year when we're all cooped up inside, we don't have the windows open for fresh air because we freeze, and the germs are there for us to share. Agency-sponsored immunization programs. As I said, you may be doing it yourself. You may be encouraging people by providing them access and telling them where they can find immunization clinics. It's critical that we educate and encourage our staff to be able to look their clients in the eye and say, I had my flu shot. Let's talk about this. You can order free hand wash, hand rub posters from the World Health Organization. They have a whole section of their website called Clean Hands Save Lives. If you go to that website, you can get posters, hand pocket cards, all kinds of videos and movies and anything you could possibly want. Post them. They come in about 8 languages on the World Health site. Post them in any food preparation or laboratory area. Promote an initiative that says this agency wants you to stay home if you don't feel well. Again, on the World Health Organization website, under the Clean Hands Saves Lives section, you will find some wonderful 14 by 18 size posters you need to put out in your waiting area, in your charting stations, wherever people congregate, that clearly say, this agency wants you to go home if you are sick. We want you well, but not if you're not. These are simple things that will not cost your agency anything in terms of time or money, but will in fact strongly promote cardiovascular risk reduction and winter wellness. At this point, each time we do one of these programs, I'd like to try and stop for a quick moment and ask each of you, what is working well in your agency? Have you looked at your outcomes lately, gone onto the CASPR website, pulled down your reports, taken a look at how you're doing? What are you doing in your agency that is working, that is keeping your hospitalizations down, keeping your emergent care down, improving functional status, improving your rate of immunization? Our goal is to improve those outcomes in every episode of care we provide. By working together, sharing our ideas, helping each other, everybody's outcomes will improve. I know I started in home health at a time when, yes, we really did tell referral sources, I'm sorry, let me give you the number for the agency who covers that town that's outside of my service area. Today, you almost never hear that. We're all so worried about getting our fair share, but we need to work together. We need to share what works, share what doesn't, and help each other. So if you have a suggestion, please feel free to either type it in or speak up. We're going to unmute the lines so that you would have the opportunity to speak up to one another. If you're shy, you can send it into our emails that were on the earlier screen, and we'll talk about it next month.
So if you have a question for Kathy, if you would press pound 6 on your phone to unmute your line. Again, press pound 6 if you guys have a question.
No? That's okay. If you think of something later, if you have an idea you'd like to share, please feel free to reach out to your state contact person, and we will certainly bring it up and discuss it next month. I want to remind everyone, I've spoken about the HHQI website and reminded you to look at the best practice package that is referencing all the immunizations information. I hope that you are going to that website on a regular basis. I would like for you to take a look at the previous topics. There are webinars and best practice intervention package on the website that relate to other topics on cardiovascular disease, improving the outcomes, reducing smoking, several other topics. We encourage you to go there, download the best practice intervention packages, and then contact your state lead, and we'll help you to look at what parts of each of those programs are best for your agency and how we can help you to implement them. HHQI does a webinar routinely on the third Thursday of each month, and you will find previous webinars archived on their website. So watch your email for the invitation to register for their next webinar. I'm going to leave the floor open for questions. If anyone has a question, if there's something specific we can do to help you. In the influenza immunization best practice package, there are very excellent handouts on how to set up your own staff and patient immunization programs in-home. Please feel free to take a look at them. If you have other questions, you need assistance setting up an immunization program, please reach out to us. The most important thing is that we reach those goals. 70% for eligible persons, 90% for our staff. Again, if you have questions, I'm here for you, and if not, Go ahead. I'm going to turn this back to Morgan.
All right, thank you, Kathy, so much. Just before you guys came out, I wanted to let you know that when you close out of the webinar, an evaluation will automatically pop up on your computer. If you could fill that out, we would greatly appreciate it. We understand you guys are very busy, so if you don't have time to do it, today we will be sending out an email tomorrow with a link to the evaluation as well as a link to where you can find the recording, the PowerPoint, and a transcript of today's webinar. The PowerPoint is currently listed on our website, and the other 2 items will be added in the next day or so. So, again, thank you for attending, and we will see you next time.
Take care, everyone.
The leader has disconnected. The conference will be terminated in 5 minutes.